Hi, I'm Gabriel Charles Mejias, and my topic is development of secondary sex characteristic and human system. So, secondary sexual characteristic. Secondary sexual characteristic refer to breast development and pubic hair growth in females. So, ang secondary sexual characteristic mag-refer siya sa breast development and pubic hair sa females. And to genital development and pubic hair sa male. So, genital development of pubic hair for the male. So, secondary sexual characteristics are those sexually dimorphic characteristics that are not directly involved in production. So, dili siya directly involved sa reproduction. For male, secondary characteristic includes facial and chest hair. So, for the male, the secondary characteristic includes facial and chest hair. So, lahi ra siya sa mga bae. So, kung imong i-compare, mga face sa laki is lahi ra jud sa mga bae. And for the male, naapon sila nay mga chest hair. So, diri sa dapit sa dughan nay mga buhok ag sa mga laki. So, napoy increased body hair and pelvic bulb. So, like the male is lahira sa bae sa pag-increase sa ilang body hair kay ang mga laki mas baga og kuan or mas tag-as og mga body hair sa mga balhibo, like dapit sa feet mas taas jud ang mga laki kaysa sa mga bae. So, pelvic bulb, lack of rounded hips. So, diri dapit sa hips, lahira sa mga laki kay kuwang ag rounded dapit. Upper body muscular build and the ability to generate muscle mass at a faster rate than the female. So, ang mga male mas faster pa mo generate og muscle, mas faster pa maka-increase sa ilang muscle mass than the female. So, for the female, secondary sex characteristics include relative lack of body hair, thicker hair on the head in some cases. So, as I say ganiha nga mas hinay pa mo tubo or mas dili baga mo kuan nag mga body hair sa mga bae kaysa sa mga laki. Like makita na nimo sa, for example, sa feet, like mas baga pa og balhibo ang mga laki kaysa mga bae. So, thicker hair on the head. So, mas baga og buhok ag mga bae kaysa sa mga laki. Pero dili ang tanan. So, sa uban ra. Rounded hips, figure, and decreased ability to generate muscle mass at a fast rate. So, mas paspas pa jud ang mga laki kaysa sa mga bae mo generate og muscle mass. So, decrease ang mga bae. And ang ilahang pelvic nga build kay kanang rounded hips sila. Decrease upper body strength, breast, ability to nurse children. So, kanang body strength nila is lahira sa mga laki nga mga kusgan, and ang mga bae na pa breast and ability to nurse children. A menstrual cycle and increased body fat composition. There are of course exceptions to any efforts to use a list of features to classify people into the conventional defined sex categories. For instance, not all women succeed in breastfeeding their infants. So, dili tanan mga female nga nakasucceed sila sa ilang pag-breastfeed sa ilang mga infant, even if they otherwise fit the conventional definition of female. So, that's all. Thank you.
Hi sir, hi classmates. I'm John Philip C. Ichalico, and my topic is all about discussing erogenous zones. Erogenous zones are areas of the human body that are especially sensitive. During sexual foreplay, stimulating these areas can encourage relaxation, promote blood promote blood flow, build arousal, enhance sexual pleasure, and help you or your partner achieve orgasm. Common erogenous zones include the armpits, lower abdomen, mouth, neck, breast, buttocks, shoulder, lower back, and genitals. Every person responds differently to stimulate in these areas, and factors like timing, mood, partner choice, and type of stimulation can impact of your preference. My opinion of erogenous zones are it is the part it is the part of a human body like ears, skin, mouth, and anymore, and example the male or female sex and have a baby. That's all. Custom historian James Slaver 1899 to 1975 come up with a theory in 1930s which suggests emphasis in the resistance to shift from erogenous zones of the body to another. Erogenous meaning any spot that across sexual responses from a potential mate. My opinion of James Slaver is he is the first inventor of erogenous zones. He is from India. He was the first human to transfer the body to another. That's all. Here are the 14 erogenous zones. Armpits, behind the knee, bottom of feet, belly button and lower abdomen, ears, genital region, hands, inner thighs, lower back, mouth, neck, nipples, scalp, and wrist. That are the 14 erogenous zones. My understanding of erogenous zone is any of the area of the body that is pleasurable to touch. Most people report that erogenous zone produce sexual pleasure when a partner touches them, especially if they are already experiencing arousal. Most people consider the genital and breast the erogenous zones, though many areas of the body can also lead to sexual pleasure. That's all. Thank you.
I'm Elson Rizvildi Compendio. My report all about human sexual response. What is human sexual? According to Neventon, the sexual response cycle refers to a sequence of physical and emotional changes that occurs as a person becomes sexual aroused and participate in sexual stimulant activity, include the intercourse and masturbation. Knowing how your body responds during each phase of the cycle can cause a your relationship, help you pinpoint any cause of a sexual problem. The, the sexual response cycle has 4 phases: excitement, plateau, orgasm, and resolution. Excitement. Excitement has a muscle tension increase, heart rate quicker, and breathing is accelerated. Skin may become flushed. The nipple become harder or erect. The vaginal lubricant begin. The woman breasts become fuller and the vaginal wall become dark purple. Plateau. The changes began. Phases 1 are intensified. The vagina continue to swell, form increases blood, and the vaginal wall turn into a dark purple. The man testicle tighten. The muscle tension increased. Orgasm. Involuntary muscle contraction begin. Blood pressure, heart rate, and breathing are at their highest rate, with a rapid intake of oxygen. The muscle in feet spasm. There is a suddenly forceful release of a sexual tension. In women, the muscle of the vagina contract. The uterus also undergoes the rhythmic contraction. The muscle in feet spasm. There is a suddenly forceful release of a sexual tension. In women, the muscle of the vagina contract. The uterus also undergoes the rhythmic contraction. Resolution. During resolution, the slowly return to its normal level of function and swelled at the erect. Body part return to their previous size. This process is marked by a general sense of well-being, enhanced intimacy, and often fatigue. Some women are capable of a rapid return to the orgasm phases with their further sexual stimulation and may experience with multiple resolution.
My topic is the basic biology of sexual behavior. And my learning objective of this topic is to characterize the biology of female and male reproductive system. The basic biology of sexual behavior. The biology of human sexuality includes the reproductive system and the sexual response cycle, as well as the factors that affects them. So, we have the biology of female and reproductive system. A female is born with all her eggs are already produced. The vagina is attached to the uterus through the cervix, while the uterus is attached to the ovaries via fallopian tubes. And females have a monthly reproductive cycle at certain intervals. The ovaries release an egg, which pass through fallopian tube into the uterus. If in this transit it meets with sperm, the sperm might penetrate and merge with the egg, and fertilizing it. If not fertilized, then the egg is flushed out of the system through menstruation. Female external genitalia is collectively known as the vulva, which includes the mons veneris, labia majora, labia minora, clitoris, vaginal opening, and urethral opening. Female internal reproductive organs consist of the vagina, uterus, fallopian tubes, and ovaries. The uterus hosts the developing fetus, produces vaginal and uterine secretion, and passes the male sperm through fallopian tubes. Then the ovaries release the eggs. What I have understand about female biology, female can be definitely defined as a person that has a vagina. Female, when they are born, their eggs are already produced. Female has a cycle that is called the monthly reproduction cycle. females are also the ones who give birth to a child or the ones who can create a fetus to their body. And now we are going to the male reproductive system. The biology of the male reproductive system, like females, males have both internal and external genitalia that are responsible for procreation and sexual intercourse. The testis produces an androgen and sperm cells. The vast difference travels from the testicles toward urethra carrying sperm. Seminal vesicles has the glands that produce alkaline fluid. Ejaculatory ducts connects vas deferens to urethra. The prostate glands producing alkaline secretion and urethra is a tube within the penis that carries sperm and semen the rest of the way to an opening the penis. The male anatomy. The male external genitalia consists of prepuce, penis, corona, frenulum, scrotum, urethral opening, and perineum. The male reproductive organs consist of testes, vas deferens, seminal vesicles, ejaculatory ducts, prostate, and urethra. Males produce their sperm on a cycle, and unlike female ovulation cycle, the male sperm production cycle is constantly producing millions of sperm daily. The semen and sperm, as a result, intercourse can fertilize an ovum within the female's body. The fertilized ovum or the zygote develops into a fetus which can born or make a child or a fetus. What I have understand about the male biology, male is definitely identified as a person that has a penis. Male also have both internal and external genitalia. Male also has a cycle, but unlike the female cycle, the male cycle produces millions of sperms every day. Male are the ones who gives contribution to the female so that they can create or make a child. The female and male also has similarities and differences. Their similarities is they have both external and internal genitalia, and their differences are female has a menstrual cycle or ovulation cycle while the male has a production cycle. My understanding about the topic, the biology of sexual behavior, includes the reproductive system of the male and female, where how the passage occurs and the cycle of the two sexes of being or having intercourse. It means that a female fertilized and born on release an egg, and a male constantly produce millions of sperms daily.
Good morning, sir. Good morning, classmates. I'm Charles Kabag, and hopefully you will enjoy my discussion about understanding the chemistry of lust, love, and attachment. Falling in love can be a beautiful, wild experience. It is a rush of longing, passion, and euphoria. For couples who remain together through the years, the rush would have been replaced by a warm, comfortable, and nurturing feelings. Each stage of this cycle can actually be explained by your brain chemistry. The neurotransmitters that gets stimulated to release hormones throughout your body. Anthropologist Helen Fisher of Rutgers University proposed 3 stages of falling in love. First, lust. Second, attraction. And third, attachment. Lust is a driven testosterone in men and estrogen in women. Attraction. At this stage, you begin to crave for your partner's presence. You feel excitement and energetic as you fantasize about the things you could do together as a couple. There are 3 chemicals that triggers the feelings. 1. Norepinephrine is the responsible of the extra surge of energy and triggers increased heart rate, loss of appetite, as well as the desire of sleep. Your body is more alert state and ready for action. 2. Dopamine. Associated with motivational and goal-directed behavior, it makes you pursue your object of affection. It creates a sense of novelty where the person seems exciting, especially or unique, that you want to tell the world about his or her admirable qualities. 3. Serotonin. Thought cause obsessive thinking. Low levels of serotonin are said to be present in people with obsessive compulsive behavior or OCD. Meanwhile, a study found that those who expressed they were in love and people with OCD both had less serotonin transporter in their blood compared to those who did not express they were in love and not have OCD as well. Attachment. Attachment involves the desire to have lasting commitment with your significant other. At this point, you may want to get married and or have children, and that's for this topic.
So my topic is all about the diversity of sexual behavior, sexual orientation, gender identity, and expression. My objective is how will people react regarding non-sexual orientation, gender identity, and how they express their feelings towards other individuals. So what is sexual orientation? A person's pattern of emotional, romantic, and sexual attraction to a person of a specific gender is referred to as a sexual orientation, male or female. We are who we are as humans because of our sexuality. So sexuality, it determines how we view ourselves and how we physically relate to others, in addition to our ability to reproduce. So what is sexual orientation? This is my opinion about sexual orientation. For the first place, you born as a child, you have the category of sex, male or female. And when you grow, you have the mindset or a feeling to attract to other person which is opposite to your sex or gender. You attract to male or female, and it's called heterosexuality. It's normal way to attract to others, because you are a normal person. You view your sex category towards other sex or gender. So gender identity. The personal perceptions of one's own gender is referred to as gender identity. Gender identity can be same as or different from a person's given sex at birth. Gender expression usually corresponds to a person's gender identification, although this isn't always the case. While a person's behaviors, attitude, and looks may be compatible with the specific gender role, they may not always represent to their gender identification. So, So my opinion about gender identity is when you born and you develop yourself and you will realize that that your sex or gender is not compatible to your feelings or your behavior. It's like for example kanang LGBTQ, they identify themselves as as a male or female, but they have the feelings of that they are opposite to their gender or sex. So for example, you're a male, you attract to same sex like male. It's like male to male, female to female, or or you are you are a individual, you are a gay, you're a gay, you're a lesbian, you are you are a bisexual and transgender person. And that's how I view gender identity. That's all. Thank you.
My topic is all about sexually transmitted disease or STD. So first, let's know what is STD. The term sexually transmitted disease or STD is used to refer to a condition passed from one person to another through sexual contact. A person can contract an STD by having unprotected vaginal, anal, or oral sex with someone who has the STD. An STD may also be called a sexually transmitted infection or STI or venereal disease or VD. In addition, it doesn't mean that the sex is the only way we can transmit the STD. It also depends on the specific STD. Infections may also be transmitted through sharing needles, breastfeeding, or sometimes through intimate physical contact. So, let's talk about the causes of sexually transmitted diseases. STD can be caused by bacteria, virus, and parasites. So, who is affected by sexually transmitted diseases? Most STD affect both men and women, but in many cases, the health problem they cause can be more severe by women. For example, if a pregnant woman has an STD, it can cause serious health problems for the baby. And let's talk about the symptoms of sexually transmitted diseases. STD don't always cause symptoms, or it may only cause a mild symptoms. So, it is possible to have an infection and not knowing it, but you can still pass it on the others. And here are the possible symptoms if you are having an STD. The first is the unusual discharge from the penis or vagina, sores or wart on the genital area, painful or frequent urination, itching and redness in the genital area, blisters or sore in or around the mouth, abnormal vaginal odor, anal itching, soreness, or bleeding, and abdominal pain and fever. That is the common symptoms if you are having an STD disease. So, How can we prevent having this kind of disease? Avoiding sexual contact is the only foolproof way to avoid STD. But when having vaginal, anal, or oral sex, there are ways to make it safer. Using condoms provide effective protection against many STD. For optimal protection, it's important to use condoms during vaginal, anal, or oral sex. Dental dams can also provide protection during oral sex. Condoms are generally effective and at preventing STD that spread through fluids, such as semen and blood, but they can fully protect against STD that pass from skin to skin. For example, you're having sex with your partner. It is it is best it is best to use condom to avoid this kind of disease. There are treatments for sexually transmitted diseases. The treatments are antibiotics can treat STD caused by bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. Antiviral drugs can keep HIV infection in check for many years, but you will still carry the virus, and can still transmit it, so the risk is lower. There is no cure for STD caused by viruses, but medication can often help with the symptoms and lower your risk of spreading the virus or the infection. If you had an STI, ask your doctor how long after the treatment you need to be retested. And that is some of the treatment of the sexually transmitted disease or STD. So typically, you'll be treated for gonorrhea and chlamydia at the same time because the two infections often appear together. Once you start antibiotic treatment, it's necessary to finish the prescription. If you have herpes or HIV, you you better prescribe an antiviral drugs. The sooner you start HIV treatment, the more effective it is. If you take your medication exactly as directed, it's possible to reduce the load in the blood so that it can hardly be detected. However, it's still possible to give your partner infection. My topic now is about methods of contraception, the natural and the artificial. So, the objective of this topic is to know what's the use of natural and artificial methods of contraceptions. And the second one is to know some advantages and disadvantages of these methods. So first, let's know what is contraception. Contraception is defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. Thus, any devices or act whose purpose is to prevent a woman from becoming pregnant can be considered as a contraceptives. So, the first topic is the natural method of contraceptions. So, what is natural method of contraceptions? Natural method of contraceptions are considered natural because they are not mechanical and not a result of hormone manipulation. Instead, These methods to prevent pregnancy requires the man and the woman not have sexual intercourse during the time when an egg is available to be fertilized by a sperm. What are the advantages and disadvantages of natural birth control? Natural methods are typically very inexpensive compared to other methods of birth control, unless a woman chooses to purchase ovulation test kits. So, the advantages of natural birth control. A woman does not need to take medication or use hormonal manipulations. No procedures or fittings by a physicians are required. And those are the advantages of natural birth control. And here are the disadvantages of natural birth control. It can be difficult to estimate or know precisely when a woman is fertile, allowing increased chances for unplanned conceptions. Natural methods are not as effective as some form of contraceptions. Ovulation test kits are used by some couples using natural methods of contraceptions, and the cost of these kits is another potential of disadvantage. And those are the disadvantages. The second subtopic is the artificial method of contraceptions. So, what is artificial methods of contraceptions? Artificial methods is commonly used to prevent the sperm from entering the ovum, inhibiting ovulations, preventing implantations, killing the sperms, and preventing the sperms from entering the seminal fluid. There are different types of artificial contraceptives you can use to prevent pregnancy, and it is the condom, the oral contraceptive pills, intrauterine device or the IUD, the contraceptive implant, the contraceptive injection, emergency contraception pills or the morning after pills, and the contraceptive ring and the diaphragm. Those are the different types of contraception you can use to prevent and pregnancy. So, for me, the most commonly used in all of the contraceptions is the condom. The condom is the only form of contraceptions that protects against most STIs, as well as preventing pregnancy. This method of contraception can be used on demand, and it is hormone-free and can easily be carried with you in the pocket, or you can place it in your pouch. So, what is the advantages and disadvantages of using artificial method of contraceptions? The advantages of using artificial method of contraceptions are: contraceptive pills is easy to take, it does not interfere with sex, it protects against cancer of the ovary and the womb, it is usually suitable for healthy non-smoking women up to the menopause. Safe sex, a high possibility that can prevent pregnancy. It blocks or prevent the implantation of the sperm to enter the woman's vagina. And those are the advantages of the artificial method of contraceptions. So now, let's talk about the disadvantages of artificial method of contraceptions. Women are mostly affected of disadvantages of using artificial methods of contraceptions. The disadvantages are: some women may experience a little cramping after insertion. Periods may become heavy, longer, and more painful. There is a risk of pelvic infection. There is a higher incidence of ectopic pregnancy. It is not suitable for women who may forget to take it. It interferes with menstrual bleeding pattern. Some women experience weight gain, and those are some of the disadvantages of artificial method of contraceptions.